Most men that have gotten to this point in their treatment have failed prior medications. They may have failed injection therapy or have had an inability to tolerate the injection therapy. They may have failed urethral gels. They may have not tolerated a vacuum erection device. You may have a bend in your penis. You may have pain when you have erections because of Peyronie's disease. Whatever the reason is, you should know that at this point you're here for a reason and you're in good hands. When you come in for your surgery, the first thing you'll do is you'll change into a gown and you'll get IV antibiotics. After you get IV antibiotics, you'll get taken to the operating room and you'll lay down on a table. You'll get some general anesthesia. We'll then do a special wash and a prep to decrease your risk of infections. I give you a special block. What the block does is it numbs your local nerves so that you have a pain-free experience when you wake up. I then proceed to make a small cut about that big in the scrotum. I put in all 4 pieces of the implant, the 2 cylinders that go inside the penis, the little balloon called the reservoir that goes in this natural space in your pelvis, and a pump down in the scrotum that's going to allow you to control your erections. I then close the skin with stitches that are going to dissolve on their own, and you're taken back to the PACU area to start the waking up and healing process. The surgery itself only takes 30 to 40 minutes. But when you come in, you're going to get a gown to change into, you're going to get IV antibiotics, you're going to get taken back to the operating room. I'm going to spend time doing a wash and a block to decrease your infection risk and to improve your post-op recovery. After the surgery, you're going to get taken back after you're awoken. I'm going to make sure that you're able to empty your bladder. I'm going to make sure that your pain is controlled and that when you leave my surgery center, you're going to leave in the safest conditions possible. All of this takes about 4 hours, so you can expect about a 4-hour day. We get clearances because we want to make sure that you have an awesome recovery. We want to make sure that when we give you anesthesia, your heart, your lungs are able to wake up from it. If you have a previous heart problem, if you have diabetes, which is a risk factor for heart disease, or even just erectile dysfunction in general, which is a risk factor for heart disease, we typically get at least a cardiac or heart evaluation. If you have lung issues, we may get a pulmonary evaluation. If you have kidney issues, sometimes we'll get a nephrology evaluation. These evaluations are important, and the clearances are what allow us to confidently say you're going to recover well. It's important you bring someone with you to drop you off and pick you up. Anesthesia does funny things to you. It can make you drowsy afterwards. It can cause what we call retrograde amnesia, where for a short period of time you may not remember what happened. And for this reason, not only do we recommend you have someone who you know and trust take you home, but we recommend someone be there for the first 24 hours while the anesthesia is wearing off. I see most patients back before the surgery, typically about 2 to 3 weeks before. At that time, I make sure all your clearances are in. I make sure that you don't have any additional questions. I make sure that there are no infections that I'm worried about. But just as importantly, it's when I go over details like this. I give you an antibiotic wash that I want you to start using about 3 days before the surgery. And that means that you have to use it and wash the genital area every day for 3 days, including the day of the surgery. We also discuss things like a vacuum erection device if you're concerned about a penile length and maybe loss of penile length up until this point. Then I encourage you to start using a vacuum erection device for 10 minutes twice a day up until the day of surgery. We typically encourage that you take all your home medications. The exception to this rule are blood thinners. These are medications like aspirin, Plavix, Xarelto, or any medication that can thin your blood. Also included in this category are NSAIDs, medications like ibuprofen or Motrin. These medications increase your propensity to bleed and can increase your bleeding after the surgery. We depend on your cardiologist or your primary care doctor or your vascular surgeon, or really whoever is managing your blood thinners, to guide us on how long you should stop your blood thinners before the surgery. This is a great question. You should not eat or drink anything after midnight the night before. We sometimes allow clear liquids that you can take up until 6 a.m. the morning of surgery. Our pre-op team will call you in advance and discuss some of these things with you. On the day of surgery, there's not much you need to bring. I would bring just a pair of comfortable, loose-fitting pants to wear. But at home, I would keep a couple pairs of tight jock straps or tight underwear or tight bicycle shorts. I would keep ice packs or frozen bags of peas or something that you can regularly ice with. I would make sure that I have a ride on the day of surgery so that you can get home safely. A question that's commonly asked is, should I shave before surgery? We generally don't recommend shaving before surgery. Most of the grooming we'll take care of at the time of surgery. But if you groom regularly, then we recommend stopping grooming within 2 weeks of the surgery. Getting cold feet is a common thing before any surgery, and this surgery is no different. And so there are a lot of things that I'll encourage you to do leading up to the surgery. I encourage you to talk to our patient educators who have gone through the surgery. They can tell you what to expect and what the post-op recovery is going to be like. I encourage you to ask me any questions that you have. And for this reason, I'm always available, but just as importantly, I schedule that pre-op visit. It's a visit about 2 to 3 weeks before surgery, and it gives you an opportunity to ask all the questions that you have come up with up until that point. As you lead up to the surgery, you're gonna come up with new questions. This is why I have an appointment waiting for you to release those questions. But in the meantime, you also have opportunities to call our patient educators who have gone through the surgery. And of course, you can always reach out to me if you're just dying to know the answer to one of your questions.